There is a scenario that is probably the most common that I come across whenever talking to clients about joining Medicare. They're turning 65 and they're going to continue to work. But do I join Medicare? Do I have to join Medicare? So, this video is going to be dedicated to you all who are going to continue to work even past age 65. Let's get into it. Hey, if you are new here, there is a link in the description below that will take you to a free Medicare 101 webinar that I do every week. Really brings me joy to approach this from an educational point of view, so I hope you like it. So let's jump into the scenario of still working. So I get this all the time, Melissa, I can't join Medicare because I'm going to continue to work. And the word can't kind of just makes my head twitch because for some reason, and it's just Social Security and Medicare, they're they're only related in really one way, is how Medicare bills you and how you enroll in Medicare. However, it has nothing to do with I must start Medicare in order to, or I must start Social Security in order to join Medicare. You can delay taking your Social Security income until your full retirement age and still be on Medicare and still work. So I know there's a lot of, I just took you in like a spaghetti like direction, but if you're going to continue to work, there's one thing you need to do is compare your group insurance to Medicare, because it is an option for you to continue working and decline group insurance and go on to Medicare. But it obviously has to make sense. There are some of you out there that don't pay anything per pay period to be on their group insurance. So it's going to have to be a really good reason, a really good needle mover to say, yes, let me go ahead and join Medicare. And just the starting, because the Part B premium at the time of filming this video is $185. So right off the bat, at least you're already going to jump to $185 in a Medicare scenario. So there better be a good reason. But there are some of you out there that are paying $300, $400, $500, over $1,000 for their group insurance, and now maybe entertaining Medicare could save you some insurance premiums every month. And then there are a few of you who are I don't run into this a lot, but maybe health is just on the decline for you right now. And you're finding yourself coming out of pocket with deductibles and co-pays, and maybe you hit your max out of pocket. And so maybe you're thinking, does Medicare maybe have more robust coverage for me at this point? And that would be another way you would entertain joining Medicare while continuing to work. And you can do that. So I'm going to bring up a chart that I didn't create it. ChatGPT did. So I told it to create a scenario, just a side-by-side comparison of really just costs at this point, the numbers of group insurance versus Medicare. So we're going to start right off the bat. Look at your most recent pay stub. Don't look here. These are just examples, but look at your most recent pay stub and grab what the heck am I paying for my health insurance on my group coverage, and then we're going to compare it to Medicare. Now, I like to call this the starting rate. It is $185. If you're a high income earner, this may be adjusted up. If you're looking at this in another year, this may not be $185. If you want to do after Part A and Part B, you think a Medicare supplement may be the best bet for you, there may be something else added to this on this bottom section here. That would be the premium for your Medicare supplement, your secondary insurance. If you're thinking about, all right, a Part A and Part B, and I'll just join an Advantage plan, the only thing we would add here is a big fat zero, because it doesn't cost you anything to go into an Advantage plan. So if we're looking at a monthly premium, maybe, north of $100, maybe you're on the $300, $400, $500 a month premium for your group insurance, you already know starting is 185, and then you add the rest, you may be under your monthly premium with your group insurance. The next number you're going to want to look at is the deductible and the max out of pocket. The deductible, just a really short recap of what that means, is the money that must come out of your pocket first. That is your part of the bill, is the first $1,500, for an example here, the first $1,500 of your x-ray, of your MRI, of your hospitalization is up to you. Then you jump into the copay scenarios on your group insurance, that $30 copay, $50 copay. Then you jump to that kind of co-insurance. But you first need to hit this. So a lot of the times what I do is just split this up into 12 and add it right on top of that, because it's coming out of your pocket anyways. Then we get to the max out of pocket, which is $3,000 to $7,000 a year. This means that all the copays that kind of stack up onto each other will go in a bucket, and once you reach 3,000 or anywhere in between here, that's your max out of pocket, or OOPM. If you look on your insurance card, it'll say it. So you're going to want to look at that number, because that's going to be, okay, the worst case scenario, you need all your organs replaced, your head replaced, and all your limbs replaced. Well, the most you're going to pay for that, it's another video. The most you're going to pay for that is the max out of pocket. Okay, that's your cap on the year. So comparing those two things to Medicare, Medicare Part B's premium is $257. All right, and that's in 2025. Depending on what plan you pick, the out of pocket max will be determined. So if you go Advantage plan, then you're looking at, I think the average max out of pocket this year is anywhere between $5,000 to $6,000. If you have a Medicare supplement, well, you don't have an out of pocket max. Essentially, your Medicare supplement caps that in some cases at 100%. So these are the things that I really recommend if you aren't working with somebody that can break down these numbers, or hey, maybe you want to do this alone. This is what you're going to want to look at. You can do all of this by yourself by going to Medicare.gov and see what plans are in your area. But then you can also talk to somebody. So whether it be a local agent near you, or clicking the link below and getting a hold of me, I'm happy to walk you through it. But that is what you want to look at if you are still working and will continue to work past 65. Hope that helped.